My greetings, and we start a new subject for you. That subject called oral surgery. So we gonna have 5 lectures this semester and also 2 lectures in spring semester. And what we're gonna learn in oral surgery is gonna be tooth extraction, of course, all instruments, surgical instruments that we use in oral surgery, right? And then you'll start to learn something about inflammatory process in maxillofacial area, and of course, including specific inflammatory process and others. So third year is dedicated to inflammatory problems in maxillofacial area. And then on the fourth year, we're gonna talk about military dentistry. We're gonna talk about traumatology of maxillofacial area and oncology of maxillofacial area. But today is the first lecture, and we're gonna talk about a bit history, a bit of examination and preparation of the patient for surgery, but means extracting tooth is a surgery procedure, but still not just extracting, but extracting is the most common procedure. Okay, if we talk about oral surgery, we should talk about asepsis and antiseptics and learn something about complication. Complications is very hard thing that we have in our area, because as you understand that we have a lot of structures in maxillofacial area, including brain and eyes and nerves and vessels and muscles and joint and mucous and everything, and lymphatic nodes. So we have a lot of problems if we do something wrong. Okay, so what is oral and maxillofacial surgery? It's a dental specialty that deals with the diagnosis and surgical treatment of the diseases, as you understand, right? Including injuries and defects of the human mouth, jaw, and associated structures that I said before. The most common oral surgery procedure, as I said before, is a tooth extraction. But not only, of course. Dental problems that we have in our region require the skill of the oral surgeon, include treatment of cyst. It could be liquid or semi-solid filled scars, tumors, lesions, and infection of the mouth and of the jaw. More complex problems that are dealt with the oral surgeon include jaw and facial injuries, cleft palate, and cleft lip. Hope you understand what is that. It's when a new baby is born with that problems. Yeah, that's a problem, and we have to manage it immediately. And placement of implants, of course, is the most how to say that, most monetized procedure, let's say that, okay, in oral surgery. Both dentists and physicians refer patients to an oral surgeon for treatment of such defects. And if we have something that we talk here as a stomatology field, like some inflammatory process in this, for example, this area, in your country, you refer that patient to maxillofacial surgery, right? And mostly maxillofacial surgeons are generalist. I mean, the médecin général.
Oh.
And dentist Even if they extract tooth, they call dentichirurgien. But that's not the call for stomatologists. But of course, when you get your diploma equivalent, I suppose that you obtained a dentichirurgien in your country. Okay, let's move on. Oral surgery has special problems. We call it issues, right? Because of few reasons. One of them is their lips and the cheeks limit access to jaw and palate. It's very obviously, right? The tongue and the lower jaw move. It's not so comfortable to work with, but so. The oral cavity opens into the pharynx, which is the passageway of air and food. The oral region is continually being flooded with saliva, as you understand. It's very obviously, and it is inhabited by the largest number and greatest variety of microorganisms. That's a huge problem, but we have to deal with that. So the oral cavity is not so easy place which you can work, but anyway, you choose it consciously, okay? So it was your choice. So now you have to deal with that. Again, history. We have few basic discoveries in general surgery, of course, but oral surgery is a part of general surgery too, as well as stomatology. I mean, oral surgery is the part of stomatology and in the same time is a part of the general surgery. So basic discoveries. We have antisepsis and asepsis. Discover, then we have a narcosis or general anesthesia, and of course, very important part of medicine is X-ray examination, or here we call it Röntgen, is the surname of some doctor, so that's why we still use that word for that. And then we have antibiotics, of course. Without antibiotics, it could be not possible to live nowadays, but still, I have to say that don't prescribe antibiotics in any case, please. Antibiotic is just in very hard clinical cases, not in itch, because I don't understand those doctors who prescribe antibiotics after tooth extraction. It's absolutely impossible to understand why they do that. Do not do that, please. Okay, so we start from antisepsis and asepsis. As you see, there was Semmelweis doctor. He was a doctor in obstetric ward of Vienna General Hospital. And there is a small history about that, but the point is, as you can read here, there is a small story. So he forced some students to wash their hands because he noticed that in other uh, hospital where there were midwives, right? So there's a woman who participating in what? In birth, okay? So they washed their hands and the students didn't wash their hands. So it was a huge difference in a point of view of mortality of patients. So he forced those students to hand washing regime. Let's say like this, and as a result, they have that all the rates of mortality were felt dramatically. It means very, very, very different. There was a huge difference between after and before. Okay, so as a fact, yeah, He discovered that hand washing can prevent infection in hospitals, and medical establishment, for its part, was not as receptive to his findings as it should have been, largely because of its commitment to the miasma theory. We have to say that a lot of things in those years, and not just in those years, in the Middle Ages, were very, very, very not receptive. I don't know why, because the society was very suspicious about everything. So that's why there was a huge problem to to prove something if you were a doctor or all those kind of engineering and all that things. So if they wanted to say something, society mostly just deny it because it was no, 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 you're wrong. Okay, so that was a huge problem. And still in this hospital, he did that. And of course, result was absolutely stunning. Let's move on. The importance of hand washing for medical professionals didn't really become understood, as I say, until scientists hit upon germ theory. Yeah, that was like this. The idea that certain diseases and infections are caused by microorganisms that we can't even see. In particular, the British surgeon Joseph Lister drastically improved patient mortality by advocating that surgeons wash their hands and sterilize their instruments in between patients. That is absolutely should be done because in other way you're gonna infect everyone. Okay, so today medical and health professionals consider hand washing a critical hygiene practice both for themselves and their patients. You have to understand that not you as a doctor and your instruments could be the source of infection. You have to understand that your patient could be the source of infection. The patient before that patient could be the source of infection. So everyone should be disinfected. Every instruments should be sterilized. So that's why we use all those things to maintain that status. Okay, so the Centers of Disease Control and Prevention even provides guidelines for how to properly wash your hand. Yeah, you can find in internet a lot of things, but of course, after a few guidelines, you just remember that thing and you use it in your practice, no problem. And what is asepsis? Asepsis is described as absence of microorganisms that can cause infections. In the dental environment, asepsis depends on a whole chain of actions that must be undertaken by a dental professional, and each step must take place without introducing microorganisms. Maintaining an aseptic environment involves the use of techniques such as hand washing, wearing protective gloves, masks, and glasses, and cleaning and disinfecting work areas, and cleaning and sterilizing instruments that come into contact with the patient mouth. Asepsis measurements. Here's an overview of the techniques used to prevent the spread of infections in dental offices. And we have a physical barriers and hand washing. So physical barriers is a staff should wear equipment that allows them to protect themselves and patients, of course, and absolutely must have. You wear a zero or overall or uniform, how you call that. It change at least once a day. And of course, we should have a mask and then protective lenses or visor. They should be cleaned after each patient, absolutely, obviously, yeah. And of course, it's absolutely cannot even imagine a doctor without gloves. They should be removed by turning them upside down and discarded after each patient. It's necessary things. Hand washing, as we said before, remains the most effective measure in preventing infections. It is carried out next things an before putting on and after removing gloves. Then after mask is removed, then before and after meals, after contact outside the surgical field, after contact with blood in contaminated material, at the beginning and end of each day, and the washing lasts from 30 seconds, as we know after guideline. Prevention with the patient. Some prevention measures can be prescribed to the patient. They protect the health of the patient, dental professionals, and other patients in the clinic. Here are some examples. We have pre-medication, we have mouth washing, we have wearing protective glasses, and of course, medical questionnaire. So pre-medication, for example, could be antibiotics, right? It's taken by the patient to prevent bacteremia. We call that when we have bacteria entering the bloodstream. Then a mouthwash containing chlorhexidine and used before the procedure. And of course, that's how we reduce the bacterial flora in the patient's mouth by almost 98 percent, not degree percent. A patient can wear protective glasses, of course, to protect his eyes from aerosols and splashes. And the medical questionnaire, that's a very important thing, actually, completed by the patient that could reveal risk factors. Those risk factors could warrant postponement of treatment or additional safety measures. Maybe in your country, there could be some kind of list of those diseases. And I have my own that I use in my practice. If, of course, it includes tuberculosis and other things and cardiac things and some allergy
Allergies.
anamnesis or
Hmm.
something like this. So it's
Yeah.
all that you need to uh, to pick the right medicament or to pick a right anesthesia solution for that patient. And it's very important. So I recommend you to have that medical questionnaire that should be signed by patient. And you have to explain to patient that it's very important to say the truth. You have to remember that all responsibility laying on you, even if they're lying. That's a huge problem. That's a huge problem. But as I said, you choose that specialty, so welcome to adult life. The very important thing, as well as others, is surface disinfection. That reduces the bacterial population, of course, by destroying some microorganisms, but not bacterial spores. It is mainly used for work surfaces like counters, furniture, chairs, electronic equipment, garbage cans, floors, and others. And the effectiveness of disinfection depends on the product that we used, and the surface must have been cleaned beforehand for the disinfectant to be effective. It is made by your nurse or dental assistant or I don't know, the cleaner if you have a cleaner in your office. So it depends. It depends, but absolutely for sure it should be done. You cannot work without surface disinfection. Let's move on. Okay, sterilization of the instruments. Um, sterilization eliminates all organisms, of course, and not like disinfection. Here in sterilization, we have that our viruses and bacterial spores also destroying. Yeah, it is always starts with a good cleaning of the instruments to remove all traces of blood, saliva, and debris because they create a screen that limits the action of sterilization. Sterilization is performed for all non-disposable instruments that come into contact with the mouth. And we have a few methods. I suppose you had some lectures on second year, and there is a lot of methods, including fast, including cold, including dry, including everything. But in dentistry, it is very recommended to use water vapor or autoclave method. It's absolutely safe for all our instruments, including endodontics instruments that contain plastic. So that plastic, it is okay, that plastic is very okay. Okay. That plastic is very
Yeah,
okay with
it's
our
hygienic plastic.
autoclave.
Yeah.
So it's 134 degree of Celsius, of course. So everything that we use in dentistry that is not disposable, absolutely okay with autoclave. So with water vapor sterilization. So here you can see the schema. I'm not sure if that word exists in English, of how we could organize the cycle of sterilization and disinfection of our dental instruments. Of course, it could be modified in some reason, but mostly it looks like this. So to um, you have to do everything that is prescribed. You cannot do as you wish or as you want, or is it possible in your clinic or not? No one cares. You have to do everything that is should be done. Okay. So, about primary responsibilities of uh, dental healthcare professionals is to create a safe and comfortable environment for their patients. Keeping this in view, the American Dental Association and the Center of Disease Control have devised protocols to prevent cross-infection among dental patients. This involves thorough cleaning and sterilization of all types and dental instruments each time they're used on the patient. I don't think that I should read everything. So here you can see some uh, most important things that you have to understand. It's cleaning, it's disinfection, and it's sterilization. I want that you notice like this, okay? So I have that you notice the difference between disinfection and sterilization. Again, once again, sterilization is a process which is performed properly, kills all microbes like disinfection, including bacterial spores. That's the difference. Present on the surface of dental instruments. So in disinfection, we're not kill spores. So that's a huge difference. So you have to understand that. Um, Okay, cross-infection control in dentistry. According to the Centers for Disease Control, all those instruments have been classified into three categories, depending upon their risk of of transmitting infection among patients and dental healthcare providers. It is critical instruments. You see the list. The semi-critical instruments and non-critical instruments. Yeah, you have to understand that because there is some situations when you have to use something and you uh, cannot wait. You can wait for all the cycle of sterilization, but if that instrument is a non-critical instrument. So you can disinfect it by dry or cold or any other methods, and you can use it for another patient. But it's absolutely prohibited to do that with the critical instruments. For example, critical instruments is a blade that you made incision. That's a critical instrument. You cannot disinfect that and use with another patient. Absolutely prohibited, okay? And the injection syringe that you use for anesthesia is not critical instrument. So you can disinfect it and use it if you need it. If you need it in some emergency cases, okay? I hope that you understand that.
Yes, yes, sir.
Cool. Processing of dental instruments before and after sterilization. Sterilization procedure. There's a few methods. So those different methods are used in dentistry. They all can be used in dentistry. They based on required depth of sterilization as well as the type of dental materials. Sterilization using a steam autoclave, as I said, is most effective and most commonly used methods. As we said, we have a steam autoclave. There is a few regime, okay? We have a dry head ovens. We have a chemical vapor sterilization, and we have a cold sterilization. All that methods are used in the industry. Not for everything, but something you can for some instruments you can use this one, for some this one, for some this one. When you will practicing, you will understand what exactly you use for this, and for this. Absolutely useful for dentistry, all four. How to ensure effective sterilization? Very important thing, because you have to understand that all those machines, let's say, okay, they could be damaged or not work well or something else or some errors inside those machines. So they could not do their work properly. Let's say like this. So in these cases, it's absolutely necessary. Each your sterilization should be proved, let's say like this, proved with all those indicators. Yeah, with those indicators. So as we have here, a complete sterilization of dental instruments is imperative. See, imperative in obtaining perfect cross-infection protocol. Therefore, that association of American Dental Association and that Center of Disease Control recommends the use of various indicators to make sure that complete sterilization has taken place. Biological, chemical, they are useful, but recommend you to use a chemical. So biological indicators. This type of sterilization test involves the use of highly resistant bacterial spores such as Bacillus Serothermotheus use as indicator for stream and chemical sterilization, or Bacillus subtilis for monitoring dry head sterilization. And we have a chemical indicators. There's heat sensitive indicators which change color upon exposure to heat or steam. They are used in the form of tapes or strips, and they are attached, to the instrument package to monitor sterilization. Uh, they could look differently, but you just you just using that, and it's absolutely imperative, very important. Let's move to next discovery. Remember, we had 4 discoveries at the beginning of that lecture. So next one is narcosis and a bit history, right? People have been experimenting with ways to eliminate pain, of course, because every procedure that we do in dental cavity or outside dental cavity, if you talk about maxillofacial area, it's always painful for the patient. So, of course, all our humans' history, we try to find some solutions for that. An artifact, see, before centuries, a lot of years before centuries, I mean, before our centuries. Not sure how you understand that, depicts opium poppy and the countless records of other remedies of pain have been found. Um, as you see in 19th century, some Horace Wells, not sure how to pronounce his name. He was a so-called dentist because they're not such dentists as we understand that meaning today. In Connecticut, observed a demonstration of nitrous oxides properly by a showman chemist. He was so impressed, he allowed himself to have the gas administered for the extraction of his own tooth, as you see on that picture. And of course, there was some not percepting things as always we had in those years, but still with history and with some new discovering, with some new chemical discoveries. Nowadays we have a lot of methods of anesthesia liquids. Okay, then was discovering of ether. Also, it's a like gas that you can inhale, and people just like make. And even nowadays, in some countries like USA, they use nitrous oxide nowadays. So that doesn't mean that it's very all things, it just means that they how to say that? They avoiding, let's say like this, injections, because injections is very problematic thing. So you can have a lot of problems for that. And nitrous oxide is absolutely safe for patient, I mean. But of course, mm, there is some procedure that you cannot avoid injections, but still it's very personal, very personal. It depends on the physiology of the patient, and of course there is not for every patient you can prescribe this or this anesthesia methods. It depends on many things, and there is a anesthesiologist, I suppose, that could say you which you can use safely. Chloroform really useful. It was useful, but not for dentistry. But still, chloroform still exists. Let's move on. More contemporary thing like novocaine and lidocaine and others caines, let's say like this. There are a lot of them. But still, you can use it nowadays. But have to say that uh, Novocaine is very toxic. Lidocaine, not so toxic, but it's very weak. Okay, so of course, these days, the most common is articaine and all those commercial names. So it could be hundred of names, commercial
Yeah.
pharmaceutical names, but it's still articaine. Okay, let's move on. And third discovery, it was X-ray examination. As you can see, we had that guy that called Wilhelm Conrad Röntgen. And this, in that picture, you can see a first X-ray image ever. It was the hand of his wife. See, you can see the the
Yeah.
wedding ring is very common picture that very iconic, let's say. We have to say a huge thanks to that Wilhelm
Yeah.
doctor that discovered that because the X-ray examination here in our days, nowadays, let's say like this, uh, it's very huge part of diagnostic.
Yes.
Of course, not the main, but a huge contribution, let's say like this, a huge contribution of X-ray for diagnosis. Of course, there is a computer tomography, there is ultrasound tomography, but still the methods is the same. It's the physics methodic of moving some particles. As you can see, a bite wing X-ray
Mhm.
is most common. Like
Yes.
they all every clinic, every dental office can do that. You can come and
Mhm.
they just like no problem. We're gonna do that. Very informative, let's say like this. Very
Yeah.
informative methods. If you need to have a picture of one of two teeth. Okay, periapical film. There is a X-ray that shows the entire tooth, tooth roots, and the surrounding bone. Then orthopontomogram. Actually, love it most of any others because you have all your teeth together, no problem, and you can see all the problems, even those problems that I covered
Didn't
or
appear
hidden,
yet. Yeah.
or you can see just in the eye examination on autoplan tomogram. You can see some hidden things, and the thing that I have to say that of course we have to understand and remember that autoplan tomogram is 2D a picture
Yeah.
of 3D space. I mean,
Mhm.
2 dimensions, 3 dimensions. It's very important to understand. So if you have something like this and then like this on the orthopontomogram, it doesn't mean that they cross. They could be like this.
Yeah.
Okay.
Yeah. Yeah.
Okay.
Yeah. Okay. Yeah.
That's very important.
It's
So
hiding there. Yeah.
yeah. So here we see the alveolar nerve in canal here, and we have a root of wisdom tooth, and we say, oh my god, it's
Mhm.
disaster, they crossed, oh my god, but in real they not,
Yeah.
maybe. So if you're not sure, just make a ct, I mean computer tomography.
Mhm.
Okay.
Okay.
Up. Here we go. A lateral cephalogram is a lateral or side view X-ray of the face, which demonstrates the bones and facial contours in profile in a single film. Um, yeah, that's what I wanted to say. I usually use in the diagnosis and treatment of orthodontic problems. In general dentistry, in other field of dentistry, we don't use it, only in orthodontics, but still it's X-ray examination and mi scusa, and cone beam computer tomography is a relatively new technique, which is mainly used to access the jaws and teeth. Its main advantage compared to orthopantomogram and other dental X-rays in that it provides three-dimensional imaging. Our fourth discovery, it's antibiotics, and of course others things that killing microorganism. Here you can see the timeline in the picture that shows the decade new classes of antibiotics research in the clinic. Yeah, it's a huge history. A lot of people did that, thanks to everyone, of course. But on the other hand, because of stupidly common using of antibiotics, now it's a huge problem with antibiotic resistance, if that word exists.
Yeah.
Okay,
Yeah.
so
Yeah.
that's a huge problem, and any any doctor in any problem prescribe those antibiotics. It's a huge disaster, and that's I'm very applauding to those countries that are close that selling antibiotics to everyone just because they want. There's a few historical periods of development of dentistry and oral maxillofacial surgery. Of course, we have non-medical care, we have dentistry in medical schools, we have classical period of maxillofacial surgery, and we have a modern period. And not sure that we have to discuss about all that ancient dentistry, but still, it was like this. And even in those civilizations, like Indus Valley civilization or any others, or even I'm sure that even in Babylon, okay, each period people did something with their tooth. Of
Yeah.
course, we cannot call it dentistry. Of course, they not make fillings that we know today, fillings. Of course, they not did prosthetic things and therapeutical things that we do today, but still, it was something. So
Yeah.
this something, it was a history. Okay. Up. The interesting thing is medieval dentistry. Of course, we talk about a Europe part of the earth, but still interesting how they, because there is a lot of movies, there is a lot of Discovery Museum and others that we can see. Okay, in the Middle Ages, there was a tooth extraction like this, really, on the streets,
Yeah.
but mostly they did it in uh,
Yes. Yes.
barber
But
office, barber
barber
cabinets. I
shop.
don't know,
Yeah, with
not
the
shop.
hammer and
I'm not sure
yeah.
that they call shops, but so the places with barbers, of course, it was because that dentistry didn't exist,
Yes.
and tooth care was not a part of general medicine. Okay, so tooth extraction was not reglamented, if you understand that. So there was
Yes.
no protocols, there was no surveillance, there was no other things that could limit, or how to say that. No one cares about that. Okay, so that's
Yeah.
why anyone who wanted, they did that. Okay, that's a problem. 19th centuries, more close to our time, and of course there was some chairs, as you see here, is from museum. Yeah, but still, uh, the people start to discover and find solutions to more comfortable work. So that's why we have a dental chair like this. Of course, today we have absolutely different, but still here as they looked those days. And the period that we call starting and born of stomatology was the fact of published that book. That book was published by Pierre Fauchard. He called like dad of stomatology or dentistry. Yeah. And as you can see, the traite des dents, le chirurgien dentiste. Here, he described almost everything that would be that was be known those days. So after this book published, we could say that starts stomatology as a separated science of medicine. Yeah, he was French. Yeah, he was a French, of course. Okay, so there is some pages from that book actually, and you can see he invented a lot of things actually. He invented a lot of methods and techniques to do some prosthetic things, including with real tooth or artificial tooth with some wires made made from metal or different things. So there was a lot of things actually invented by him, and he was and he is the dad of stomatology, okay? But it's just historical things. I think that you already know it. So most interesting thing is the 20th century. It's so two significant advances that gave great impetus to the evolution of dentistry. So we have the introduction of ceramic dental crown. It's just revolution, okay? And it really was a revolution. It was a Canadian doctor, Charles Lalonde, but maybe he was Charles, maybe. Who knows nowadays, right? In 95, German chemist Alfred Einhorn, I suppose, synthesized procaine for the first time and gave the commercial name of Novocaine. As we say, that was one of the first discovery that lead us to nowadays. And of course, there was some remodeling of dental chair. You can see the picture from maybe 60s or 70s, maybe 80s even. But still, it was interesting period of time. Of course, don't forget about toothbrush uh, industry and all that things. So let's move to nowadays, more interested maybe and more practical sense for you. So today, we as a dental surgeons, sorry, we as a dental surgeons work in dental surgery office, is a part of dentistry, yeah, which is a branch of medicine, as I told you at the beginning, dealing with teeth, gums, and the mouth. A dentist or stomatologist are the practitioners of dentistry, and they deal with the treatment, prevention, diagnosis, and study of conditions, disorders, and diseases of the oral cavity. This covers the oral mucosa and the dentition, as well as all related tissues and structures, like the jaw and facial maxillofacial area. Um, Not sure if we should talk about examination. Maybe you already passed that in second year, but still, examination of a patient with surgical pathology of the maxillofacial area is a complex of studies that are conducted to identify the individual characteristics of the patient for the purpose of diagnosis, selection of rational treatment, monitoring the dynamics of the disease, and determining the prognosis. And of course, we have some algorithm for that, an algorithm of examination of maxillofacial patient. We have survey, and here we could hear the complaints of our patient, the anamnesis. It's an anamnesis. Anamnesis morbi, it means anamnesis of the disease, and anamnesis vitae, it means anamnesis of the life. It's in Latin, okay? And then we have face examination. Of course, it's very important because we could have some traces of problem, like fistulas, like like scars and others. And of course, for that, we have some instruments like spatula, dental forceps, dental mirror, dental probe, and Bowman probe, and button probe. But it's just if you need it. In most cases, the above examination algorithm is sufficient for full diagnosis of the conditions, but if necessary, depending on the features of the disease and their general somatic status of the patient, additional methods of examination may be performed. And here we can see the laboratory diagnostic methods. Yeah, students. Yeah, blood, urine, wounds, saliva, and others. We really could examine that for dentistry. Really. Diagnostic methods. It's radiological examination, computer tomography scan, and others, and also functional methods of diagnostics. Thermometry, electrodontal diagnostics, functional chewing tests, and other things that we could use to make a whole picture of our problem. Using all those methodics and putting all together, we come to some conclusion. Conclusion is a diagnosis. Diagnosis is a key for uh, good treatment. So it's very, very important, everything. Um, Laboratory research. As you can see, we have morphological study, microbiological research, serological examination, and others really useful for our patient. You could say, oh no, why we need that? Of course, if we dealing with fillings and root canal treatment, of course, it's not necessary. But if we talk about oral surgery, that we have a blood, we have a pus, we have a pain, we have inflammation, we have a lot of bad guys here, okay? So of course, we need to understand with whom we're fighting. So that's why we need to do that microbiological research and serological examination and all the things really needed. Because if not, you can fight in with those microorganisms with antibiotics of wide action, and there is no reason for that, and there is no result for that, and there is no recovery. Yeah, there will not be any recovery for patients. So please remember about those methods. Biochemical blood test. We're not going to stop on this, but we also can do that and really need it. Means when you do some diagnostic, especially with osteomyelitis and some problems with odontogenous infection and others. So remember about that. Electroradiography, constant radiography, angiography, and stereolithography. Those methods that you can use also for your treatment. No problem. But not with each patient, of course. Just in a case if you need it. Here you can read a few sentences about those methodics, but we move on. So ultrasonography, echo-ostometry, not sure if that pronounced like this, but still.
Yes.
Magnetic resonance imaging. Magnetic resonance imaging, not so useful in dentistry because it shows mostly soft tissues problems. And of course, we can use that when we have traumas or injuries uh, of maxillofacial area, when we very interested into the zygomatica orbital or zygomatica maxilla regions, because there's a lot of soft tissues there. So that's very interesting, but not for everyday diagnostic. Uses. Okay. Final clinical diagnosis is determined on the basis of the preliminary diagnosis. And it's made after the subjective and objective examination, as you well know, of the patient. The result of additional methods of examination, the differential diagnosis. It's very important to be good in differential diagnosis because that's the part of part okay, so when student learn something about some disease, there's a part that calls differential diagnosis. And mostly students just skip it because it's like, oh, it's something like, what is that? We just skip it. We need to see how it looks and we need to know how it treat. That's it. But different diagnosis is, I would say it's more important than everything because there is a lot of situations when you have a lot of manifestations that could be look like 3 different, 5 different, even 7 different diseases, but it's still they all have same manifestation, same. And you said, okay, that's parasititis, for example, but it is not. Or you can say it's osteomyelitis, but it is not. Okay, so the different diagnosis is very important. I mean, critically important to understand. Okay, let's move for most interesting things. It's extracting of the tooth, of tooth extraction. It calls exodontia. Really? Exodontia is a procedure that incorporates the principles of surgery and many principles from physics and mechanics. When those principles are applied correctly, a tooth must probably be removed, impact from the alveolar bone without untoward sequelae. Yeah, it does exactly as I told you at the beginning um, about consequence. This operation does not require a large amount of brutal force, as everyone think actually, but still it requires some force, but not a brute, okay? And rather can be accomplished with thinness and controlled force in such a manner that the tooth is not pulled from bone but instead is lifted gently from the alveolar bone. have to understand, you have to understand that um, tooth extraction shouldn't be traumatic for patient. So it's not so easy going procedure, but on the other hand, it's not so uh, hard hard um how to say that. Okay, it's not easy, it's not too hard, it's not too easy, but still you have to understand that
Still difficult, yeah.
you okay, many times that you see the X-ray, for example, and could say, ah, that would be easy to extract. No way. You know, it's not always like this. I'm talking about not exactly about the space when we work, but I'm talking about the bone, the periodontium, and the tooth, how they interact with each other, and how to
Okay.
could be easy or not easy to extract that tooth. It was a real X-ray that I obtained from colleague, and she referred patient to me with a wisdom tooth. This guy is a wisdom tooth, the last one. And on the X-ray, you can see it's very nice rounded line of the
Yeah.
roots here. It's very
Yes.
easy to extract, and I could think, and I really thought, that would be easy. Okay, no problem. And then, as I told you today, not everyone that you see could be exactly what you see. See that?
Yeah. Yeah. It
Y-
depends on the angle of the vision.
Yep. And that
Yeah.
is this guy that looks very easy to extract. You can see the curvature
Yeah.
of the
In the bottom.
apex.
Yeah. Yeah.
That's a huge problem. And as a result, I spent
Yeah.
1 hour and a
I get
half
it.
to
You
extract them.
have to rotate it. Yeah.
It was not so
It's a
easy,
pain.
but
Yeah.
according to X-ray, it was absolutely easy going.
Yeah.
One thing that I could say to you to not left the small pieces of the tooth, especially is very common with apexes of molars, of upper molars. It happens because they're all positioned or situated in different dimensions. So when you extracting with forceps that tooth, one of them could broke and left in the bone. And I strongly recommend you to not leave them
Of
in a
course.
bone.
Yeah.
You have to use some instruments like here. You can buy those instruments in store. But it's my it's my pictures. The right one is my real picture that I show that I use headstrom file. You know that
Okay.
H file
Yeah.
or headstrom file or how you call that
Yeah.
to remove the broken part of root. It's very important. The main thing in tooth extraction is indications. Without indications, dear students, you are not allowed to remove tooth. I'm not sure about law things in your country, but I'm sure that there is some protocols that prescribe exactly indications in which cases you can extract the tooth. So we could divide it into general and local indication. In general, it could be odontogenous, chroniosepsis, and chronic odontogenous intoxication, as you can see. Odontogenous disease of any organ. Yeah. And local indications. There is 6 groups: senation, functional, prosthetic, orthodontic, that you very, very like it, right? Aesthetic and combination of above mentioned. It means that if patient wants to remove the teeth just because he wants, he he said to you, okay, just please remove me that tooth. Um, you cannot do that. You cannot,
Mm.
because there is no any indication that, of course, we can remove absolutely healthy tooth just by orthodontic indications. If we need some place or in some prosthetic situations, when we have just one tooth, for example, one tooth on the upper jaw, and we understand that we need to do denture on the upper jaw, and that one tooth would be killing for everything. So we need to remove it, and then we
Yeah.
have a whole denture on upper jaw. It fixes uh, more effective that with one tooth. I mean,
And,
it's just like it's practicalities, but still, we have some.
and it's also cheap than the implantations.
Of course. But there is a lot of people who cannot afford to do implantation. So,
Yeah, exactly.
unfortunately. Um, and we could, if we talk about sedation, you can see here what exactly and in which cases we could do that. Then, functional indication, right, is those which concerns uh, cases of injury of soft tissues by impacted or semi-impacted tooth. Um, Jesus. Hope. Yeah. Prosthetic, as I said, single teeth. See? Oh yeah, which compromise denture stability. See that? It's everything is here, but I'm trying to find in my memory. Okay, denture. Yeah, denture. Denture is the artificial jaw, like you put here and put
Yes.
out. Okay, orthodontics. As I said, it's just if we need some place. Aesthetic. Malposed, erratic, teeth that spoil appearances, especially while smiling. Yeah, could be. Combinations, of course, also associated with treatment of teeth, impacted teeth, in ineffective orthodontic treatment, diseases, or conditions when it is impossible to perform tooth treatment, the patient insists on tooth extraction. It's not could be done if patient insists, as I said, on tooth
Yeah.
extraction. Just said to that patient, Auf Wiedersehen, because it's out of law.
Okay.
Auf Wiedersehen, it means au revoir. Because, of course, that patient could address to another clinic or dental office.
Yeah.
And of course, they could do that just for money or
Yeah.
some other reasons. But still, contraindications. Oops. Very interesting things. Of course, there could be some contraindications for teeth extraction. Um, we divide it into absolute uh, contraindications for tooth extraction, and still mm, uh, we know that there is some diseases and conditions which require operations suspending, or if it's possible, preoperative medication. Some relative contraindication. Why relative? Relative, it means that we can wait some time and then we still do that tooth extraction. It could be heart disease. It could be kidney disease. It could be infectious diseases. It could be blood disease. It could be central nerve system diseases. It could be mental disease in acute condition. Of course, not sure how it pronounced in English. Schizophrenia.
Schizophrenia.
Schizophrenia, maybe, not sure. I have to check it, but you understand it.
Yeah.
And teeth placed in malignant tumor. Yeah, that's not possible. Do not do that.
Yeah.
Even if patient is very, very struggling of that. But if your tooth, not your, but problem tooth, situated close or even into malignant tumor, absolutely do not touch it. Don't even dare to touch it, because you're gonna have a lot of problems that cause metastasis. That's not good, and please do not touch those teeth. Okay, acute disease in the respiratory tract and pregnancy. Why relative? Again, because we could treat that problem, we could resolve that problem, and then we still can extract our teeth or teeth, depends how many surgeons. Okay, let's move on. Before the extraction should be thoroughly rinse their mouths, of course, it's very obviously. Let's move on. Yeah, the steps. I don't know why, but still many of places where they could ask you to extraction steps. I mean situations, like examine or practical classes or some testing. They very like those extraction steps. So we have five steps.
Yeah.
And all those 5 steps is they formed extraction as extraction. So
As told. Okay.
yeah, before extraction, of course, we need to put a patient in the chair in a proper position, of course, but still not 5. We have elevation of circular ligament is still not of those 5. So elevation of circular ligament, it calls syndesmotomy. It's the word for that. So there is a periodontal ligature around the tooth, and we should destroy it before extracting. And then we have first of them. It's applying the forceps on a tooth. It's the first step. Then we have advancing the forceps to enamel sediment line. Very important. And then we have closing up or fixing the forceps with whole hand. And then 4th one is slacking of the tooth. It could be luxation.
Rotation.
And it could be rotation. What is the difference? If you have just one root tooth, it is possible to do rotation like this.
Yeah. But with 2, it will be.
But only if you have one root tooth.
Okay.
Please remember that. If you have 2, 3, or one root tooth that is very they're like squeezed,
parallel,
like in scissors of law, jaw is very squeezed, but still one, but very squeezed. So you cannot rotate it as you want, okay? So if you have a 3 or 2 or 3 roots, it calls luxation. What does it mean? It means the oral and vestibulum. And we call that oral vestibular vector or moving. So it's like this,
Yeah.
okay?
Yeah. Yeah.
Or it's like this, it's the same,
Mm,
or it's like this. So that is luxation, that you move to oral vestibular line.
mm. Okay.
But please do not rotating those tooths that have more than one.
Yeah. They will damage
Um,
the.
of
So,
course, it would be very and even
yeah.
extremely traumatic for the patient, and 100% you will broke the root.
Yeah.
Okay. And fifth one is pulling out a tooth from socket. It calls traction.
Traction. Okay.
Traction. And all those together, it is extraction.
Extra.
Okay.
Okay. Yeah. I got.
Starting from applying the forceps on a tooth
Mhm.
and traction. All those 5 steps are required.
Mm.
Whew. Okay, there is a lot of things and even complications in this lecture, but we could continue next time because
Okay.
we have 5, so we have a lot of time to have fun. Okay.
It's much fun.
Okay, wish you the best of luck
Thank you very
and
much.
be
Have a nice
kind.
day.
Have a
Thank
nice
you,
day.
and
Bye
be
bye.
safe.
Yeah, you too.